If you or someone you love is over 70 and taking multiple medications every day, you need to hear this. Studies have found that 9 common medications that millions of seniors take without a second thought have been linked to causing dementia faster than it would naturally develop. We are going through every single one today. Number 9. Benadryl. Benadryl is one of the most reached-for medications in America. It sits on an open shelf at every drugstore, costs just a few dollars, and most people grab it without hesitation for allergies, a cold, or trouble sleeping. Because no prescription is needed, most seniors assume it is gentle and completely safe for long-term use. That assumption is one of the most dangerous ones a senior can make. Benadryl belongs to a group of medications called anticholinergics. What that means in plain language is that it blocks a chemical messenger in your brain called acetylcholine. Acetylcholine is what your brain uses to form new memories, stay alert, and process the world around you clearly. When that messenger gets blocked, your brain loses one of its most essential tools for thinking and remembering. Studies have connected regular Benadryl use in older adults to a significantly higher risk of developing dementia. A 2023 study in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs like Benadryl regularly and found they had a 54% higher risk of developing dementia compared to people who did not take them. That is not a small number. That is more than half again the normal risk from something sitting in plain sight on a drugstore shelf. After 70, your brain naturally produces less acetylcholine than it did when you were younger. It is already working with a reduced supply of the very chemical Benadryl blocks. When you take Benadryl regularly, you are blocking what little remains. The impact on an older brain is significantly heavier than the same dose would have on someone in their 30s or 40s. Check the label on anything you take for sleep, allergies, or anything marked nighttime, PM, or allergy relief. Many of these products are simply Benadryl under a different name. If you take it regularly for allergies, ask your doctor about newer antihistamines that do not cross into the brain the way Benadryl does and are considered far safer for long-term use in seniors. Number 8. Proton pump inhibitors. Proton pump inhibitors are prescribed for heartburn, acid reflux, and stomach ulcers. You probably know them by names like omeprazole or Prilosec and Nexium. They are among the most commonly prescribed medications in the world, and millions of seniors have been on them for years, sometimes decades. They feel safe because the symptoms they treat are so common and because doctors prescribe them so routinely. What most seniors are never told at the pharmacy counter is what these medications do to the nutrients your brain depends on. Your stomach needs acid to pull certain nutrients out of food, and one of the most critical is vitamin B12. Vitamin B12 protects the wiring of your nerves and your brain. When proton pump inhibitors suppress stomach acid over months and years, your B12 levels quietly drop. So do magnesium and calcium, 2 minerals your brain cells need to fire and signal cleanly. When the brain is starved of these nutrients over time, it starts to misfire. You get confusion, memory slips, and mental fog that can look and feel exactly like the early stages of dementia when the real cause is a nutrient your medication has been quietly blocking for years. A large 2016 study published in JAMA Neurology examined more than 73,000 people, aged 75 and older, and found that regular users of these medications had a 44% higher risk of dementia than people who did not take them. After 70, your body already absorbs nutrients less efficiently than it did when you were younger. Adding a medication that further reduces your ability to absorb B12 and magnesium compounds a problem that is already present. Many older adults are walking around deficient in these nutrients without any obvious single symptom pointing to the cause. If you take one of these medications every single day, that is the conversation to have with your doctor. Many people can move to a gentler option that is far less likely to affect nutrient absorption and thinking over time. The goal is the lowest dose for the shortest time, not a pill taken forever out of habit. Number 7. Benzodiazepines. Benzodiazepines are prescribed for anxiety and sleep problems. Common names include lorazepam, diazepam, and alprazolam, known as Ativan, Valium, and Xanax. They work by calming an overactive nervous system, and at first, they can feel like genuine relief. The panic eases, sleep finally comes, and the racing thoughts slow down. For many seniors, they feel like the only thing that works. What changes over time is the picture. These medications create a slow chemical sedation of the entire brain. Learning becomes harder. Mental flexibility decreases. Many people describe a sense of moving through a fog, feeling emotionally flat, or no longer feeling entirely like themselves. These changes happen gradually, which is exactly why they are so easy to miss and so easy to blame on age. A 2022 study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used these medications for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting versions that stay in the body longer showed an even stronger connection. After 70, your body processes medications more slowly than it did when you were younger. A medication that a younger person clears overnight can linger in a senior's system for much longer, accumulating over days and weeks. The sedating effect builds up quietly in fatty tissues, including the brain, and the cognitive cost grows with it. If you have been taking one of these medications for more than a few weeks, do not stop suddenly. Stopping abruptly can be dangerous. Work with your doctor to reduce the dose gradually over weeks or months. There are gentler alternatives for both anxiety and sleep that do not carry the same long-term risk to brain health. That conversation with your doctor is worth having sooner rather than later. Number 6. Bladder drugs. Bladder medications are prescribed for what doctors call overactive bladder, the sudden urgent need to get to the bathroom that can reshape an entire day and make leaving the house feel stressful. The most common one is oxybutynin. The relief these medications provide is real, and the embarrassment they spare seniors is real too. But there is a serious cost to the brain that most people are never told about. Oxybutynin works by blocking the same brain chemical that Benadryl blocks, acetylcholine, the messenger your brain uses to form and store memories. And unlike some medications that stay mostly in the body, oxybutynin crosses easily into the brain and parks itself directly in the areas where memories are made. Taking it month after month, year after year, steadily reduces the brain's ability to do one of its most important jobs. A 2019 study published in the British Medical Journal followed people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher. Nearly 1 in 2. And almost none of them were warned. They were told a pill would help with the bathroom urgency. Nobody mentioned it might be quietly dimming their thinking at the same time. After 70, the brain is already producing less acetylcholine naturally. When a medication that blocks that same chemical is added on top of that age-related decline, the combined effect on memory and thinking can be significant and can develop faster than either factor would cause alone. If you take a bladder medication and you have noticed your memory or thinking has changed since starting it, bring that up with your doctor. There are newer options that work through a completely different pathway and do not block acetylcholine at all. You do not have to choose between managing your bladder and protecting your brain. Number 5. Statins. Statins are prescribed to lower cholesterol and reduce the risk of heart attacks and strokes. Names like simvastatin and atorvastatin, known as Zocor and Lipitor, are among the most prescribed medications in the world, especially after age 60. They do an important job, and for many people, they genuinely belong in their daily routine. But there is a side of this medication that rarely gets discussed. Your brain is close to 60% fat, and it uses cholesterol to build and maintain the insulation wrapped around every nerve, so signals travel fast and cleanly. When cholesterol is lowered significantly, the brain can be left short of a raw material it actually needs to keep those connections working properly. The statins that cause the most concern are the ones that cross most easily into brain tissue. A 2023 study published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, and the higher the dose, the steeper the decline. Some people describe frightening memory blanks, a familiar name gone, a conversation just finished completely erased, a route driven for 20 years suddenly unfamiliar. After 70, the brain's ability to maintain and repair its connections already slows down with age. When a medication reduces the cholesterol the brain uses as a building material on top of that natural slowdown, the impact on thinking and memory can become noticeable faster than most people expect. Not every statin affects the brain the same way. Some cross into brain tissue more easily than others. If you have been on a statin for years and have noticed fog, forgetfulness, or confusion creeping in, that is a real conversation to have with your doctor about whether your current statin is the right one for you. This is not a reason to stop a medication that may be protecting your heart. It is a reason to make sure you are on the one that does the least harm to your thinking. Number 4. Amitriptyline. Amitriptyline is an older antidepressant that is still widely prescribed today, not only for depression, but also for nerve pain, sleep difficulties, and migraine prevention. That versatility is exactly why it became so widespread. It looks like a medication that can quietly handle several problems at once. But underneath that useful surface, it is one of the most powerful blockers of acetylcholine still in common use. Many seniors taking amitriptyline for nerve pain or sleep have no idea it is an antidepressant at all. They were given it for a specific problem and never told what category of drug it is or what it does to the brain over time. The brain chemical it blocks, acetylcholine, is the same one your brain relies on to communicate between neurons and to store new memories. Block it strongly enough and long enough and memory problems stop being a rare side effect and start becoming an expected outcome. A 2015 study published in JAMA Internal Medicine followed more than 3,400 adults, aged 65 and older. Those with the highest exposure to anticholinergic drugs like amitriptyline over a 10-year period had a 54% greater risk of developing dementia. And the research showed it does not even require a high dose. A small nightly dose taken consistently for years can quietly erode cognitive function without any warning sign until the loss becomes significant. After 70, this erosion happens faster. Your brain is already working with lower acetylcholine levels naturally. When a medication blocks what remains over months and years, the decline in memory and thinking can accelerate in ways that look identical to early Alzheimer's disease, and the medication is rarely the first thing anyone thinks to question. If you or someone you love takes amitriptyline, that is a conversation worth having with a doctor soon. For nerve pain and for sleep, there are other options that do not carry the same burden on the brain. Asking specifically about alternatives that are considered safer for seniors is a reasonable and important question. Number 3. Paroxetine. Paroxetine, sold under the name Paxil, is one of the most widely prescribed antidepressants in America. It is used for both depression and anxiety, and on the surface, it appears to be a modern and gentle option. Most people taking it assume that because it is a newer generation of antidepressant, it is safe for long-term use. The detail that almost nobody hears is what sets paroxetine apart from every other antidepressant in its family. Paroxetine is the one antidepressant in its class with strong anticholinergic activity. That single characteristic separates it from related medications because it affects the same acetylcholine system that has appeared throughout this list. Most antidepressants in the same family do not have this problem. Paroxetine does, and that makes it a very different medication for a senior's brain than it might appear. A 2021 review published in Frontiers in Psychiatry examined older adults taking different antidepressants and found that paroxetine users showed measurable declines in short-term memory, word recall, and attention within the first 12 months. Seniors taking it were 30% more likely to show early signs of cognitive impairment than those using other antidepressants in the same family. The American Geriatric Society has placed it on a formal list of medications considered potentially inappropriate for seniors for precisely these reasons. After 70, this matters more because your brain has less acetylcholine to spare. A medication that blocks even a moderate amount of it can produce a more pronounced effect on memory and thinking than it would in a younger person taking the exact same dose. If you take paroxetine, ask your doctor about whether switching to a different antidepressant in the same family might be appropriate. There are options that provide the same mood support without the same concern for cognitive health in older adults. It is a straightforward conversation that could make a meaningful difference. Number 2. Antipsychotics. Antipsychotic medications include names like quetiapine, risperidone, and olanzapine, known as Seroquel, Risperdal, and Zyprexa. These were originally developed for serious psychiatric conditions like schizophrenia and bipolar disorder. But today, they are frequently prescribed to older adults for sleep problems, restlessness, and agitation, often in nursing homes and care facilities where keeping a confused or restless senior calm is a daily challenge. Many seniors and their families do not realize they are taking an antipsychotic medication at all. They were told it would help with sleep or with agitation. Nobody explained what category of drug it is or what the research shows it can do to an aging brain over time. That gap in information is one of the most serious problems on this entire list. A 2022 study published in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even when they had no history of dementia before treatment began. These medications suppress dopamine, a chemical involved not only in mood but also in focus, planning, and memory. When dopamine is reduced significantly, the brain becomes slower, less responsive, and less able to hold on to new information. After 70, the brain is already more vulnerable to chemical changes that affect thinking and memory. The margin for disruption is smaller. What might produce a mild effect in a younger person can produce a dramatic and rapid decline in cognitive function in someone over 70 whose brain chemistry is already more fragile. If you or a loved one is taking one of these medications, the most important question to ask the prescribing doctor is why it was started and whether it is truly necessary. Many behavioral symptoms in older adults can be improved through consistent routines, better sleep management, and treatment of hidden pain without any medication at all. When medication is genuinely needed, the lowest possible dose for the shortest possible time reduces the risk significantly. Number 1. Taking multiple medications together. You may have been expecting one final single medication at number 1. The reality is more important than that. The greatest danger for seniors is not any one medication on this list. It is taking several of them together while nobody is adding up the total effect on the brain. Many of the medications on this list work through the same pathway. They all reduce acetylcholine, the brain chemical responsible for memory and clear thinking. When you take 2 or 3 of these medications at the same time, even at doses that seem individually small and harmless, the combined burden on your brain compounds rapidly. The effect is not 1 + 1 = 2. It is 1 + 1 = 4 or 5 or more. Think about how easily this happens. A senior takes Benadryl every night for sleep. They take a bladder medication every day. They take amitriptyline for nerve pain. Each medication was prescribed or chosen for a real reason. Each one on its own might produce only a small effect on thinking. Together, they are blocking the same brain chemical from 3 different directions simultaneously, while no single doctor may be aware of all 3. A 2022 study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest combined burden from these types of medications had a 120% higher risk of dementia within 10 years. More than double the risk. And the overwhelming majority had no idea this was happening to them because no one had ever explained it. After 70, this combined effect is more damaging and faster acting than it would be at any younger age. Your brain has less acetylcholine to begin with. Block it from multiple directions at once, and the impact on memory and thinking can become visible within months rather than years. The single most important thing you can do after watching this video is bring every medication you take, every prescription, every over-the-counter product, and every supplement to your doctor or pharmacist and ask for a full medication review. Ask specifically whether any of them affect the same brain pathways. Ask whether all of them are still necessary. Ask whether any can be reduced or replaced with something safer for long-term brain health. Medication-related cognitive decline is one of the most preventable threats to the aging brain, and unlike many causes of dementia, it is often reversible when it is caught early enough. The brain is far more resilient than most people realize, but only when the source of harm is identified and removed. Now, we want to hear from you. Are any of these medications ones you take every day? Tell us in the comments below. We read every single one. And if you found this helpful, please give this video a like and subscribe so you never miss what we cover next. Thanks for watching.